Patients at the Komfo Teaching Hospital's Renal unit were asked to make payment for their dialysis treatment depending on the type of services required. This is concerning as it contradicts the NHIA's directive to commence a 6-month free dialysis support program for NHIA's card-bearing renal patients below 18 and those above 60 years. This situation has left some patients worried.
Well, what's your condition? Tell us.
My condition is, as you see, I'm on dialysis. If you are to come in, you will see, because it was formerly here, and then here, normally, and then you see how it is. So if I'm hoping that I can be relieved.
Now, the requirements for you to get it as a free treatment is one, you should be above 60 years, and then you should have the NHIS card. Are you above 60 and do you have the NHIS card?
I have it.
You have it, and how old are you?
I'm 68 years old.
68 years?
68 years.
Now tell us, since you came here and then you are paying it yourself, contrary to what is out there, the directive of the NHIA, what are your words to government and the NHIA itself? Because right now, you're making the payment despite the directive they've issued.
Yeah, I mean, I'm making the payment because there was no, directive that I shouldn't pay. I came here, I asked them, they said, yes, we have to pay because they have not received any directives that I shouldn't pay.
So what would you say to government and the authorities since they've made this directive?
Well, I said to the government, what they said was good, but then what I've paid, they have to pay my money back to me.
You're asking them to pay your money back to you?
Yeah, they have to pay my money back to me.
Because some of the person sika we ediaba easy.
It's difficult to get money to pay for the dialysis treatment. Our helpers are even tired. We plead with the government and the NHIA to help us, just as they indicated. But management of the hospital says they are prepared to roll out the initiative. However, an official communication must be made to the hospital by the Ministry of Health, hence the delay. Dr. Yao Oparelabi is Deputy Medical Director at CATH.
We are ready. We are ready to roll out. What we are only waiting for is, because we work under the Ministry of Health, anytime we are going to embark on any activity, we need to receive directives. We need to receive directives from the Ministry of Health because we work under the Ministry of Health. So before we commit our resources to this very important activity, we just need to receive, all we are waiting for is to just receive a directive that go ahead, start, and these are the modalities for operation and so on. No, we are going to start a service. We are going to use what we call consumables. The consumables are the things that we use, the liquid we use, the tubes and so on, which you finish and you have to discard. All those cost money. So we need to also recoup the money. And we know that the money is already been made available for the age brackets that have been described in the NHIA CEO's his address when he mentioned the package. Yes, so we are ready, and all we are waiting is for the Ministry of Health we work under to just give us the green light to go ahead. And usually we want to also, they communicate with us through documents, so that's all we are waiting for.
Well, since the NHIA issued a directive to have some free dialysis treatment for kidney patients, a number of them have been trooping into the Komfo Teaching Hospital's renal unit to have their dialysis treatment. But contrary to what is out there, these patients would have to make payment for their dialysis treatment. Well, the payment for this treatment here at the Komfo Teaching Hospital is a little above 500 Ghana cedis. They are asking government and authorities of the NHIA to intervene. For Joe News, my name is Anna Mwachitankwa Yadom. Kumase.